Singing River Hospital in Gulfport, Mississippi is bursting at the seams. The waiting room is full.
Williams and Ruffin, a little extra on your paycheck.
Patients are being treated in hallways, and hospital administrator TIFFANY MURDOCK is just trying to make it work.
Like a couple of hours though before we can take her.
The state of Mississippi is reporting some 3,500 new COVID cases a day, its biggest surge since the start of the pandemic. Only 36% of residents are fully vaccinated, and it's the unvaccinated now filling hospitals.
Is it frustrating? Period. Yes, but towards the individual personal patient, no, because we're to look at them as they're coming in, they have a problem, we have to fix it. We're going to take care of you no matter what. But now you're like learning your science from Facebook, and that's frustrating.
With the regular intensive care unit overflowing with COVID patients, the hospital 3 weeks ago created this second ICU. This room used to be for people recovering from surgery. Now the staff has squeezed in 6 beds for very sick COVID patients.
The Delta variant changed everything. I mean, they're younger, sicker. One day they'll have a, sick chest x-ray. 24 hours later, it's whited out like full pneumonia on both sides. I've never seen anything like it.
TESSA Williamson was hospitalized for 13 days and had to deliver her first baby a month early while tethered to an oxygen machine to help with her breathing. She hadn't been vaccinated because at the time it wasn't recommended for pregnant women.
I am that 27-year-old active patient with no comorbidities that, if they got COVID, they would be fine, and it wasn't the case. I was this close from intubation in the ICU. I was this close from not being able to come home with my brand new baby girl.
The family is doing well, though Tessa remains on oxygen. Her case hit the staff hard because Tessa works in the hospital. Her admittance inspired 30 co-workers to get vaccinated.
They saw that it could happen to them, and another one told me, it's not just Tessa, it's the 25-year-old that we just rolled in and had to intubate because they couldn't breathe. It's the 35-year-old that we had to extubate because their lungs collapsed.
After a rise in hospitalizations, a rise in deaths usually follows. No amount of vaccinations now will immediately stop that process. And so it is feared in Mississippi, still darker days are to come.
1376, COVID pneumonia intubated from Hancock.
Heidi Zhou-Castro, Al Jazeera, Gulfport, Mississippi.